of the Diabetes Chai Chat. I'm very pleased to see so many of you. I know others are going to join us. It's very cold today outside, so I think the turnout will be quite large. Our subject today is diabetes prevention and treatment, tips for taking control, something that we all want to do. I hope everyone has their chai with them and that they have registered for the weekly Chai Chat and encouraged other people to do so. We welcome our resident doctor, Dr. Hina Trivedi, who joins us from Leicester, and from Bangladesh, Dr. Ishan Rahat, who is our specialist in Bangladesh. Our guest speaker today is one of the rising stars of the medical industry. It's Ravishan Pramanathan, who graduated from Charles University in Prague and now is at the Queen Elizabeth Hospital in King's Lynn at the NHS Foundation there. He did his foundation training year in general and acute medicine, progressing into GP training, where he is currently rotating through psychiatry and pediatrics. And some of you will remember him. He was one of the three wise people who helped us through the Silver Star inquiry into why so many BAME people died during COVID, more BME people as a percentage than anyone else. And I'm sure if you're at home, you're watching all the proceedings about COVID on the television. So he was very helpful, and we're very grateful to all the work that he did on that. So he's taken time out from King's Lynn Hospital, the Queen Elizabeth Hospital, to join us today, and we're very grateful. Ravishan, you have about 15 minutes to talk to us, and then we've already got about 5 questions lined up, and I have a question of my own. So it is over to you in Norfolk. Good evening.
Good evening, everyone. As Keith kindly introduced me, my name's Ravi. I'm one of the GP trainees here in King's Lynn, and I'm currently starting my pediatric rotation after finishing some psychiatry before I go into, so ironically, I'm going into diabetes after this. So I just wanted a quick conversation about diabetes, things we can do to kind of prevent, manage, especially within our community. We are at higher risk of developing type 2 diabetes. There are some genetic factors that play a role, some lifestyle factors. Our diet is not particularly good, but we can do certain things which will help us to take control of diabetes. So what is diabetes? It's a condition where one's blood sugar is too high. We have 2 types. Type 1 is when the body doesn't create enough insulin, and insulin is a hormone that we have in our body that allows us to kind of bring down our sugar levels in layman's terms. Type 2, which is what we call preventable diabetes, is when the body develops a resistance to insulin. And one of the major contributing factors to that is obesity, being overweight, having high sugar foods. So this is a type 1, type 2. Obviously, there are some overlapping factors between them. They both can cause serious health complications as well as health problems throughout our lives. And both require us to make what we call lifestyle modifications, as well as medication compliance if we ever get to that point that we need medications. So type 1 is obviously mainly got a genetic role. It can't be prevented or cured, whereas type 2 can be prevented through lifestyle modifications. Quite often, a lot of us may fall into what we call the pre-diabetic condition, in which our blood sugars aren't at the levels where we may be considered to be diabetic in terms of a diagnosis, but we would probably be getting there unless we make some changes in our diet or through lifestyle modifications like doing more exercise. Type 1 people typically take insulin injections that we take under the skin, whereas in type 2 initially we opt for oral medications, and if the oral medications aren't really controlling it well enough, then we can move towards insulin injections as well. Typical symptoms that someone with diabetes may have is feeling very thirsty. We call this polydipsia. Frequent urination, polyuria. Some people have increased hunger, increased appetite. Some people may have blurry vision. There's a lot of different factors, and it depends on the level of how bad your control of your blood sugars are, in essence. So, how do we diagnose it? We tend to use these finger prick tests. They're quite useful. We can also do blood tests. Finger prick tests are obviously what you can do at home. They're not as accurate as the lab tests, but nevertheless, I think with the way technology is moving forward, we can get there. There is also a HbA1c, something we look at in the blood, basically suggesting how, in layman's terms, how sugary your hemoglobin is. And we have a cut-off value which may suggest that your blood sugar levels are increasingly on the higher side, that your hemoglobin is being affected, and that's how we can test for it. Normally, if you're doing home monitoring, which I do recommend to all diabetic patients to be on top of it, because ultimately you guys are the ones who can control it better than the doctors. I take that with consideration, obviously, with a pinch of salt. And you guys can monitor your things on a daily basis, whereas a doctor might not be able to do that. So you want to keep your blood sugars, for example, your fasting plasma glucose when you wake up, you want to keep it below the level of 7. You want to keep your HbA1c below, ideally below 45. In a great situation, it'll be below 40. Anything above 45, then we may be considering a diagnosis of pre-diabetes moving towards diabetes. So I think we need to be careful in the way we go about our lifestyle, focusing on going to the gym, or perhaps going to do things where we can reduce our waist size, our waist circumference. So I mean, I think with regards to what we can do foods wise, so we have something known as the glycemic index, and foods can have based on their glycemic index, it can tell you how fast your blood sugar can go up when you eat it, which is why we say eat brown bread rather than white bread, because your blood sugars in white bread go up quite a lot faster and higher than if you were to eat brown bread, where the blood sugars will go up. Ultimately, it will go up with a lot of foods you eat, but it will go up a little bit slower, and it won't go as higher. So try and put more barley or more fruits, vegetables. You can implement that into your diet. Ultimately, if you do get the diagnosis, what we can do to kind of slow the progression down is through exercise, medications, healthy diet, avoiding alcohol and tobacco products. These are some of the bare minimum we can do. And I do understand it can be difficult to be disciplined and to maintain a healthy lifestyle, especially when you're working and you're unable to make that time for the gym. But you could go for a walk instead, just something to keep the heart rate up, make sure you're feeling active. When you feel good, some people report increased stress can cause their blood sugar levels to go up. I'd certainly noticed that in psychiatry. Certain medications, such as steroids, can increase your blood sugars. So, ultimately, if you do have the diagnosis, do see your doctor. Do try and get yourself in a diabetes prevention program or in a healthy lifestyle program. You can speak to your GP. There's many services available for you guys. And I think that that's largely the best way we can prevent it. I think that with the newer medications, obviously a lot of you are probably on metformin if you do have diabetes, or your grandparents, your parents may be on metformin, and that's a great drug, to be honest. There are obviously side effects, as there are with any medication, but I think the importance with medication is compliance. Taking your tablets after a meal, making sure that you're regular with your medication, you're avoiding alcohol products and forgetting your medication, tobacco, because with diabetes, it's not the acute problems, and by acute I mean it's not the short-term problems, it's the long-term problems. There's the long-term complications. There's increased risk of heart disease, there's an increased risk of stroke, kidney disease. Diabetes can cause a lot of complications. It can affect the vessels in your legs, it can affect the nerves in your legs. So I think some of you who haven't been controlling your diabetes or haven't been regularly seeing your GP, I understand it's quite difficult to get a GP appointment nowadays, and I think the whole country is venting their frustration towards GPs. Not to say that GPs aren't doing the job. I do think GPs are quite overloaded themselves, but um, it's ultimately up to you guys as well as your GP to try and find the right balance between medication, lifestyle, diet, and what you can do is by carefully monitoring how you are at home, monitoring your blood sugar levels, and by regularly seeing your GP, I do think we can get towards preventing or ultimately slowing the progression of complications. Another common complication with diabetes is dementia, and dementia can be quite a problematic thing because diabetes affects the small vessels, and once the small vessels in the brain are affected, the newer medications that are out for these kind of dementias, they don't work as effectively, and they're not technically indicated for what we call a vascular dementia, where the blood vessels are affected typically by these kind of diseases where there is vascular complications. So in conclusion, I think eat healthily, exercise as much as you can within reason. Obviously, if you had a recent heart attack, touch wood, no one has, but if you have had a recent heart attack, then obviously take it easy. But I do think that trying to keep your heart rate up, doing something to keep yourself active, avoiding alcohol products, avoiding sugary drinks and high glycemic index foods, I think ultimately will help us control your diabetes. And another thing I would mention is if you do have diabetes, I do recommend you get a glucose monitor at home just to keep track of how things are. I'm going to open the floor up for questions now.
Thank you.
Keith, you want to facilitate the questions?
I will. I'll just do a thank you, and then we're going to go over to Leicester. I'm in London at the moment. I just want to say thank you so much. It's so refreshing to have a new GP who is prepared to think and look at new ideas. Because many of us, when we first went to our GPs, like myself, and we were told we had diabetes, we were immediately prescribed metformin. We were not given the kind of all-in-round solution that you've given. And I want to start with the first question, which is about what we eat. Even though I'm type 2, I buy my Freestyle Libre because it controls me, and I stay in the green box. And yesterday, after I had quite a nice chicken biryani in Leicester, I have to tell you, which I knew was going to shoot me up there, but I was given cucumbers with it. So I ate the cucumbers first, and actually my reading was very, very steady. I think it's really helpful if our GPs knew more about the vegetables that we eat, and then tell us, yeah, we're going to give you metformin, but actually you should eat the cucumbers, or you should eat Kerala juice, or you should eat carrots or something. This makes a huge difference to people like us because we believe still everything the GP says. And even a simple chart handed over by the GP when you're pre-diabetic makes a huge difference to a person. So my first question is, do you agree that actually eating is one way? Healthy eating is exercise, obviously really important as well, but actually healthy eating is the first thing we should consider before we start cramming metformin into our mouths?
Definitely. I wholeheartedly agree with that statement because medication is not always the solution. Medication should be not a last resort, but never the first resort. If there are preventable things we can do, I would wholeheartedly recommend that. with diet. Definitely our diets with rice, curry, as you said, biryani, is not the healthiest of meals, regardless of how fantastic it may taste. But I don't think it is the healthiest of meals. I don't think there's any harm in treating yourself to a biryani every now and then, but having a biryani on a regular basis may not be the way forward to controlling your diabetes. But yes, I do agree with you.
Thank you. So from Canary Wharf in London, let's go over to Leicester. Hanif at the Silver Star Centre has already got some questions. Over to you, Hanif.
Thank you, Keith, and thank you, Dr. Ravishan, for that presentation. We're really grateful for your time. Our first question is something which you touched on very quickly. It's from Salim, and he's asking, why is every new diabetic patient is prescribed metformin?
Well, I think there are a lot of reasons for this. Metformin's been around for a very long time, and we are aware of the side effects. We are aware of how well it works. But I also want to mention that metformin is a very cheap drug, and it's cheap to produce, and it's cheap for the NHS to use as a first-line agent. So it's important to remember that, yes, it is a good drug, and it is a good first-line agent in type 2 diabetes. The downside nowadays is that people are on many different medications, people are living a lot longer, and metformin may not necessarily work as well if your kidneys aren't as good, or if you're not very good with your compliance of your medication. So I do think metformin is a good first-line agent, but nowadays we do have newer agents which are a little more expensive for the government, but it is better to start with metformin and then see how a patient tolerates metformin.
Great, thank you. On to that question from Anilas asking too, does type 2 diabetes medication have side effects?
Yes, there can be side effects, like with all medications. Most common side effects include some nausea. Some people can have some vomiting. Some people can have some low blood pressure, or they can feel a bit dizzy after taking some medications. Some people can have what we call hypoglycemia, where the medication then drops your blood sugar far too low, and they can have the associated symptoms with having low blood sugar rather than high blood sugar. So it is like with everything, medications can have, at the end of the day, they are drugs and there are side effects. They can be toxic to the kidneys, which is why your dose may need to be adjusted if you have chronic kidney disease. You see, everything is kind of connected. The diabetes can affect the kidneys can then get worse functioning, and when the kidneys get worse functioning, the medications may not work as effectively, or they may not be cleared as efficiently as they would in a person with normal kidney function. So that's something we need to consider. There are side effects, but what a GP or your endocrinologist, the decision that they make would be, they always weigh the pros and cons. They weigh the risks versus the benefits. So the risk of you developing heart disease by having a very poor blood sugars or very poor control of your blood sugar is probably higher than the possibility that we may cause the kidneys to dry up a little bit. And that's something that we always consider. It's always a risk versus a benefit analysis, which a doctor is always having to carry out.
Great, thank you. Question from Jasbir. He's asking, does diabetes remission prevent future complications?
Well, I think it's what's important with diabetes remission. It's a very technically not the best way to put it is not remission. It's by preventing diabetes. Yes, hypothetically you can prevent the complications of diabetes. But it's all about early lifestyle changes. And obviously, a lot of people go with diabetes and not knowing they have diabetes for quite a while, or they could have prevented it when they were 30 and then they were diagnosed at 40. Yes, you can prevent the complications or slow down the progression of these complications from occurring. So I would agree partially with that question. Yes, it is very possible.
Okay, thank you. Question from Smita. She's asking, why is diabetes common in elderly?
Well, as you get older, your organs, which produce the hormone like insulin, they naturally they have wear and tear. Your body develops a bit more resistance to the hormone. Your the physiology of the body kind of gets a little bit weaker as you get older, which is natural, which is normal. But that doesn't necessarily mean that all patients above 75 have diabetes. I mean, there is a genetic component. There is a component with related to your lifestyle, what you've done, if you are a smoker, if you're a non-smoker. It's not necessarily in all elderly patients, and I do ask all patients to engage in a healthy lifestyle if possible, eat healthily, and it should help control their blood sugars. Because the better their blood sugar control is, the better the risk of being without complications.
Thank you. Asha has just submitted a question, and she's saying, my parents are from South Asia. They have diabetes, but I'm in my 40s and I'm quite healthy and fit. But is diabetes hereditary, and will I get diabetes later on in the years?
There is a genetic component with all types of diabetes, more so with type 1 diabetes. There is a genetic component, yes, but that doesn't necessarily mean that you will be diagnosed with diabetes. I think it's important that you maintain your healthy lifestyle, you maintain doing these things, and it doesn't necessarily mean that you will have it, but it doesn't necessarily mean that you won't have it. I think it's about you close monitoring. There is the risk there. So if she's ever concerned, she can always ask her GP to repeat a blood test or do a finger prick test to check the blood glucose. And from there, we can always make decisions about whether she needs to implement further healthier lifestyle. Maybe if she's exercising twice a week, maybe we can make it 3-4 times a week. Maybe if it's just half an hour a day, just on the treadmill or walking around the local park. These kind of things can make all the difference.
Great, thank you. One more question that's been submitted by Dinesh. His question is, I took my metformin twice accidentally, first 2 tablets at 7 p.m. and then again accidentally at 8 p.m. I was okay, but would like to know what should I do?
Well, in that scenario, Dinesh, I would advise that you try and remember the timings of your regular medications. If you're taking it in the morning and then once again at 7 p.m., that's fine. I wouldn't recommend doing a double dose at 7 p.m. just because there is the risk that we can drop your blood sugar far too low. So what I would recommend is if you do forget your morning medication, try and take it as close to the time as possible. If you've forgotten it up until the evening, then just take your evening dose and then repeat from the morning as you would normally. Some side effects could be some nausea, vomiting, diarrhea, increased urinary frequency, dizziness. So I think I wouldn't recommend doing a double dose at the time. I would recommend that he tries to remember as best as he can, but doing a double dose in the evening is probably not ideal.
So if he did accidentally take his tablets,
I would recommend he hydrates well.
Okay.
And looks out for possible side effects. But I mean, taking one-time overdose of metformin 500 or 1,000 milligram tablets is not going to kill you. It's not going to kill a normal person. But I mean, I think what you need to remember is that if you do this on a regular basis, then it can cause complications to your kidneys, it can cause complications to your blood sugars. So try and be as compliant as possible, because that is part of it. Monitoring and compliance when you already have the diagnosis helps a patient they control their own diabetes, they stay in control, and they can make these decisions.
Great, thank you. I think we've got some questions asking. It's Tulika who's raised her hand if she wants to unmute herself.
Hello. It's a very interesting presentation, so thank you very much. I take my blood glucose readings after food, before food, whenever I can during the day. But I'm curious to know if I didn't have diabetes, what sort of readings would I have before a meal and 2 hours after?
Before
because
a
I have
meal,
nothing to compare it to.
okay, so before a meal, you'll probably have it between 4 and 6.
Right.
And after a meal, it should be below 11. below 10 and 11.
Because so basically, if you don't have diabetes, you're still going to see a rise.
Of course,
Basically. Yeah.
yes, most
Okay.
definitely. Because the food you eat, any kind of food you eat, will always cause the blood sugar to increase. So don't be concerned that your blood sugar is increasing because you're eating, because that's normal. But the problem with diabetes is that your blood sugar increases significantly more than it would in a normal person, because you're not having the insulin. The insulin is not working as well as it would in a patient without diabetes, if that makes sense. So your
Insulin
insulin,
resistance, yes. Yeah.
exactly. So because you have that insulin resistance, your blood sugars might not drop as well or as fast as they should after a meal, and whereas in a normal person who doesn't have diabetes, then their blood sugars will drop as soon as the insulin kicks in and starts dropping their blood sugar. Does that make sense, Talika?
Yes, so basically the normal person's is going to mop up the blood sugar much better and
Exactly.
take it where it needs to go, compared to me, because I have got diabetes. One other question, if I may, if sorry. I had a meal, the same meal, but one of the meals had pita bread and the other didn't. The one without the pita bread, my levels were within the range you mentioned, but sort of level. And the other one with the pita bread, it went up to about 9 something, and then it dropped to 4.6,
Okay.
which you hadn't done. So the average would have been lower with the pita bread than without, and I just couldn't understand
It does,
it.
yeah. To be honest, that is quite surprising. To be honest, there's a lot of individual factors that may play a part. Whether you had a cup of tea in between, or if there could be a lot of other factors that could play a role. I wouldn't look too much into how much your blood sugar rises with the same meal, and why it's not going up with pita bread. What I can recommend is that obviously pita bread can be carbohydrate, and that can cause your blood sugar to increase more than normal. But if you were to have pita bread, which is whole grain, then it may not increase as much as it would with, say, a white pita bread, if that makes sense. So it is possible that these things can happen. I don't think I can come up with a scientific explanation as to why this is the case, but I wouldn't look too much into it. I would recommend that you look into keeping it within the range, trying not to go too low or too high.
Yes, I definitely do that. And I must say that, measuring regularly helps a lot, because you're dealing with objective evidence rather than just guesswork.
Definitely.
So thank you very, very much. And sorry, I asked two questions.
Don't worry, no problem.
We've got a question from Marcia. Marcia, if you want to.
Yeah, thank you. Very interesting. I'm just wondering, at times I experience severe hunger pangs, even though I've eaten like half an hour before, and sometimes I wake up in the night with really severe, as if I hadn't eaten anything, as if I'm starving. And I'm wondering, is that part of the diabetes?
That could be a part of the diabetes, definitely. Feeling hungry, feeling like despite eating is quite a common symptom. You're not alone in feeling that. I wish I could tell you the solution to that would be to have a meal, but that's probably not the ideal thing to do. I think what you should do is drink some water in between these hunger pangs, try and maintain your blood sugar within the range, because keeping it within the range is the ideal situation. When your blood sugar gets more under control and your HbA1c becomes better under control, I don't think you will be experiencing these symptoms as frequently.
Thank you.
Thank you very much. A couple of questions from me to finish off. Firstly, the ideal HbA1c for a type 2 diabetic. You mentioned 45, and then you went back to those single figures. What should it be?
I think in a patient with type 2 diabetes, the HbA1c is already a little bit on the higher side. I would recommend that you keep it between 40 to 45, just because
Now, how much is that in single figures? The single figure
In
calculation.
the single figures, I'll have to work it off the top of my head. 1 second. I need my calculator. Probably between 6.5% and 7%.
Right. And what about easy snacks? I think it was Marcia who talked about getting up and feeling very hungry. People suggest nuts. You should have
Well, yeah,
peanuts
nuts.
or walnuts. What's the best easy snack to eat, which will not drive you over the
There's
top?
many. I would say whole grains, wheat, barley, these kind of things which have a low glycemic index may help the patient feel fuller and keep their blood sugars within the range or not put them too much out of the range. Fruits and vegetables can increase the blood sugars, but they do have a low glycemic index, so they will increase the blood sugars on a slower rate. Prunes, these kind of things are quite helpful. I'm just thinking off the top of my head what else there can be. Some juices.
And a good time for the last meal at night?
I would recommend trying not to eat after 7:30 p.m., to be honest with you. I think 7 p.m. you have your meal, you had your metformin or whatever, and then you kind of try and avoid eating for the remainder of the night. I know it's a little early, especially within the Asian community. Some of us like to eat at 9:30, but I think for all purposes, I do recommend eating it just because it helps us digest the food. It doesn't get stored into fat when you end up eating too late and you sleep. It gives you that time for your body to process the food and digest it without being in a sleep state. So it is definitely better to eat earlier. And I think the reflux is definitely a lot better if you don't eat so much later.
Yeah, absolutely. I will pass that message on to the Premanathan family when the next season.
I think my father is not the best patient.
Dr. Ravishan Premanathan, thank you so much. It's been so refreshing to hear from you. And good luck in your next session, which is on diabetes as part of your overall existence as a general practitioner. And perhaps when you finish that, you can rejoin us and talk to us about any new things that you found out. But we're very grateful. It's been a great session. Thank you so much. You're welcome to stay. We know you're very busy. We've got other issues that we talk about, like the diabetes headlines. If not, thank you. We're very grateful.
Thank you very much.
Thank you so much.
Thank you.
From Kings Lynn, which is a lovely part of the country, let's go back to Leicester and talk to Annie, who has the diabetes headlines of the week. Annie, are you there?
Good evening, everybody. The top headlines for today are as follows. Headline number 1, diabetes is one of the reasons for feeling fatigue, study finds. Fatigue or extreme tiredness is a common symptom of diabetes. It can result from high sugar levels to other diabetes complications, or be due to medication side effects. There are many reasons why diabetes can cause fatigue, including changes in your blood sugar levels, medication side effects, mental and emotional issue from diabetes, and being overweight. Headline number 2, poor nutrition lead to poor mental health. 2 literature reviews led by Professor Radhik Basiri reveal that poor nutrition not only increases the risk of developing type 2 diabetes, but also adversely impacts the mental health, particularly anxiety and depression. The Centers for Diabetes Control has found that people with diabetes are 2 to 3 times more likely to experience depression compared to those without the condition. The correlation is the foundation of current treatment that often include therapy, medication, or a combination of both. However, the relationship between diet, mental health, and diabetes is a relatively new area of study. Headline number 3, WHO calls for higher tax on alcohol and sugary drinks. Around 2.6 million people across the world die from drinking alcohol, while more than 8 million die from having an unhealthy diet, according to WHO. Adding that implementing a tax on them will reduce these deaths. The UN agency also said that raising the tax will not only reduce the consumption of these beverages, but also help companies to make healthier products. Thank you.
Thank you very much, Annie. That was very helpful. Let us go over to back to Leicester, a different part of Leicester, and ask Hanif, how are we doing on the steps ladder for this week?
Thank you. The average daily steps in reverse order with Nasreen, 2,248, Kirti with 4,990, Keith with 5,100, and topping it this week is Dinesh with 5,769 steps daily.
Thank you very much, Dinesh. Well done. You're currently in the lead. In the Premier League, you're right at the top. You are Manchester City, or should I say Arsenal, I think. Good news is we're trying out a pilot. Silver Star is working with the Belgrave Neighbourhood Centre to try and see whether people who regularly attend the Belgrave Neighbourhood Centre would like to join our steps ladder. We're going over there next Monday to try and sign people up, putting pedometers on their phones. And so we will have intensive competition from next week. Hopefully more people on our ladder. In the meantime, a big thank you to Dr. Ravishan Premanathan for giving us his excellent talk from the Queen Elizabeth Hospital in Kings Lynn. Thank you to Hanif and his team of Silver Star from Leicester, and to all of you for joining us, and of course to Hina Trivedi and to Ishat Rahat for joining us from Bangladesh, and Hina, who's joining us from Leicestershire. We are going to close the edition today, and we're going to be back again next week as we prepare for Christmas. Remember, not too many mince pies. Try and resist. Thank you for joining us.